Hi, everybody. Welcome back to the Kidney Coach YouTube channel. I am Fiona Chin and I'm joined by...
Hola, yo soy Dr. Mateo, Dr. Matt Lyon. Nice to be here with you.
We wanted to take the opportunity today to talk to you about pH, all good things pH and the kidneys, and why things like keeping your pH in a good range and things like the alkaline diet or having an alkaline diet, why you'll hear that again and again when it comes to kidney health and kidney disease. So yeah, let's dive into that topic and see where we go today. Matt, did you want to kick us off, or where did you want to...
I'll just say what we're talking about with pH, and Fiona's going to explain some of the science behind it, but pH is this general term that tells us about acidity and alkalinity, basically the environment, the atmosphere, the milieu of the body. And when that's in a healthy range, and that'll differ organ to organ, but when that's in a healthy range, you work well. When your pH is well, you work well. And when it doesn't, we get major problems. And when we talk about kidney disease, this is like mission critical to understand. And I'll let Fiona tell you what the kidneys do, but stress from bad food, from the standard American diet, by and large, creates a very pro-acidic environment. And all of that is associated with inflammation, breakdown, degeneration, dis-ease, and all manner of tissues, but especially the kidneys. So this is really about just cleansing and creating a detoxified, balanced, healthy atmosphere so that your cells can do what they do best, which is self-regulate and self-heal and help you express the best version of you.
Perfectly said. So let me run through this in a couple of steps. So a pH scale, so the pH scale ranges from 0 to 14, 7 being neutral in the middle. So anything less than 7, and this is where it gets confusing because the lower the number, the more acidic you are. So from 1 to 6.9 is acidic, and then 7 you've got is neutral, and then a pH higher than 7 is what we call an alkaline level in whatever you're testing. So a normal pH in the blood, and there's this thing called homeostasis in the body. And homeostasis is the body's always trying to regulate everything to keep within these little narrow ranges. And so you may know, and I'm jumping around a bit here, but in kidney disease, one of the things that goes out is, and why people have to have dialysis, that when we get to late stage 4 and stage 5 chronic kidney disease, the body can no longer keep this acid alkaline balance exactly where it needs to be. So the blood pH needs to be around 7.35 to 7.45. And the body really likes to be around 7.4, right in the middle of that range. Now, it's a small range, but anything over that, which is too alkaline, and anything lower than that, which is too acidic, which is more what happens in chronic kidney disease, is a disaster for the body because the body can't operate outside this narrow window of something called this homeostasis. And let's compare blood. So blood, say 7.4, to your stomach pH, which is about 1.5 to 3.5, if I've got that right. I'm pretty sure that's right. So that's a really acid stomach, high acidic levels in the stomach to break down food, but the blood has to be this sort of, we'll stick with 7.4 for ease. So what makes blood pH change or become abnormal? So generally healthy people have no problem. The kidneys are removing acids from the blood the whole time to keep that all in a lovely, healthy level. But things like diabetes, asthma, heart disease, kidney disease, lung disease, gout, infection, shock, urinary tract infections, been to dehydrated, diarrhea, all of these things can change pH. So acidosis is when the blood pH drops below 7.35 and it becomes too acidic. Alkalosis, I think I said that right, alkalosis is where your pH is higher than 7.45 and it becomes too alkaline. The two main organs, as I've said, are the kidneys, and they remove acids through the urine in excretion, and then the lungs. And a lot of people forget about the lungs, but the lungs remove carbon dioxide through breathing, and that actually helps regulate pH through the respiratory system. So you've got things like respiratory and metabolic acidosis. And when people are rushed to hospital, these are two things that you'll often see them checking by the little monitor that people put on their fingers. They're checking respiratory acidosis, and that's when the blood pH is caused by a lung or breathing condition. And then you've got metabolic acidosis, and that's when the pH changes are due to kidney conditions and kidney issues. So there's a couple of ways that you can test it. Blood gas test, which I just mentioned, that's the one that's measuring oxygen and carbon dioxide in the blood. And then a doctor can also check your blood pH, which is to check that. But you can also check it using urine and saliva, which are the ways that we recommend in actually the program that we use, the kidney disease solution. And you can just buy test strips to do that. Now, obviously, urine and saliva have a different pH range to blood, and they are a bit of a feedback to what your body system is doing in general. But if you're rushed to hospital, and if you actually want to know if you're in something called metabolic acidosis, which is what the kidneys control, you would have a blood test for that. But easily to check at home to see if your body's moving in and out of a bigger range, we can check saliva and urine. So what else do I want to tell you about that? I guess the big thing I want to tell you is
urine is urine. Urine is urine, if you are an American watching this.
Oh, is that so funny? It's so different.
One of the great joys of getting to work with Dr. Duncan and Dr. Fiona is the joys of the Australian accent. And different people might interpret urinary pH or pH of your urine and your saliva differently. In the school sort of I came from was that saliva could be or would be the most closest approximation to blood pH, secondary, of course, to a blood test. So yeah, these simple tests are amazing. Can you talk to people a little bit about using pH strips in the kidney disease solution?
Yeah, so we obviously recommend that people test their pH strips to determine if their body's pH needs immediate attention or not. pH test strips are a really quick and easy way that you can do at home. Your urinary pH fluctuates between 6 and 6.5 in the morning, and 6.5 and 7 in the evenings. And that is a healthy range. So 6 to 6.5 in the morning, 6.5 to 7 in the evenings. So you can test your urine first thing in the morning you can get these little test strips, and I might even put a link to where you can get them from. And you just get a little cup or something, collect your urine, put a dipstick in there, dipstick in there, and it will have like different colors, and you then compare it against the bottle, and that will tell you what your pH is. So 6 to 6.5 in the morning, and if you're doing it in the evening, it should be 6.5 to 7. Your body tends to move towards that more alkaline scale, and the evening being that the higher the number, the more alkaline that you are. Now, your saliva generally stays between 6.5 and 7.5 all day. So again, they're a bigger range than what your blood has to work between, because that blood and that homeostasis that I said doesn't get such a big fluctuation that, say, your urine and that your saliva will. So if you're testing saliva, 6.5 to 7.5 all day, and that's a healthy range. The best time to test your pH is about 1 hour before a meal and 2 hours after, because when you eat, obviously your body's going into digestion mode. That will slightly change the pH. We used to recommend that you test your pH 2 days a week. And it's important to understand that you're not testing stomach acid. Stomach acid. Did I say that right? Stomach acid or the pH of the stomach. You're testing the pH of the body's fluids and tissues, which is completely different.
So a question I have is, and I'm just getting in the head of someone who's got kidney disease and they're reading the book. How can we get our body and our blood more alkaline? So how do we take this knowledge and improve it based on the test results we're getting?
That is a great question. And that brings us to the alkaline diet. And actually what I can do, Dr. Matt, is share my screen and I can show you some foods that are alkaline. And what they do is, so when you eat, the foods drop off and release these ions, and it's the ion exchange and the gap, we call the anion gap which helps tell us what the pH is. So, and that's what the kidneys do. They're pulling these ions in and out. So when you eat certain foods, they're delivering a different package of these key nutrients and these ions that change the pH of your blood. So some foods have more of an alkaline contributing factor to them, so they will deliver more ions that will make the body shift more towards an alkaline pH, and then others are really acidic and they'll move you towards more acidity. The problem, before I share my screen, with kidney disease is people tend to move more towards an acidic environment rather than being over alkaline. That's something I really wanted to reiterate. We don't often see people being over alkaline. We see people being over acidic. And kidney disease,
all chronic disease, right? I mean, that's sort of like the stress byproduct, especially the stress diet byproduct is over a tendency and a proclivity to be over acidic, right?
Yeah, that's right. And it's
so
not
the more we follow what you're going to say, I mean, it's going to help every aspect of health.
Yeah, that's right. You probably heard the adage and the saying that, and the science that shows that cancer cells can't live in an alkaline environment. They thrive in acidity. Yeah. And so the things we often do when we're working with people with the diagnosis with cancer is we're looking at alkaline diets as well. So when we're working with kidney disease, as you move towards, say, stage 1 down to stage 5, the point of dialysis is to help people stay and keep their blood pH in the correct levels. That's part of the major process of what dialysis is doing. Dialysis is taking over the function of the kidneys to remove these acids out of the blood, which then helps to keep you alkaline. So when we put in a more alkaline diet, we're actually helping, and we're giving foods that are going to donate and help with more of that balance. So you're going to stay more in that range. Now, you're still going to stay in that 7.4 range that your blood wants. But like I say, as your kidneys get sicker and sicker, they're going to move you towards more acidity. And it's going to be harder and harder to keep your blood in that 7.4 perfect range. So what we do is we compensate by using foods that are more alkaline to help shift that needle down that way, to take the pressure off the kidney so they're not having to clear so many acids out, which will move your blood towards acidity. Does that make sense?
Yeah, it makes total sense. So I'm like, what should I eat?
All righty, let me show you what we should eat. Okay, can you see my screen okay there?
Really good, actually, yep.
Okay, so this is a download that we've actually got for free off our website, and we'll put the link in here, but feel free to head across to kidneycoach.com and download this information. It's all there free for you. And this is a list of alkalizing forming foods. So we've tabled them in, say, vegetables, fruits, proteins, grains. And what you'll see here is an alkalizing diet is going to be highly compromised of mostly vegetables and fruit. When we look at the protein section, there is not any red meat here whatsoever. There is absolutely no white meats here. So one of the things that we know in kidney disease is that a plant-based diet, especially for people in stages 4 and 5, is far better than eating a lot of animal protein. And as Dr. Matt was talking about before, the standard Western diet is often very high meat, lots of salt, sugar. Sugar's very acid.
Big Macs.
Big Mac fries, all of those things are really highly acidic. So what we would encourage you to do if you've got any sort of forms of kidney disease in there is to go towards a more plant-based diet. And here's a list of really great vegetables and things that are what we call alkalizing. So like cauliflower, celery, kale, good old kale. We love kale. Kale's good for everything.
Kale's made a comeback in the last 5 years.
It has. And then things like, cherries are one of my favorite fruits for people with kidney disease because of the fact that they're alkalizing, but they're great if you're prone to gout. Actually, cherries are one of the things.
Awesome. And such a good source of vitamin C without having to take synthetic ascorbic acid, which then would acidify. That's awesome.
Yeah, cherries are great at removing uric acid from the system. So one of my favorite.
Cool. I often use tart cherries after workouts for recovery because it makes my blood more alkaline. So I'm less sore and I can put on more strength.
I love it. And then you've got a couple of grains are also very acidic. So that's something I wanted to reiterate too, because people go plant-based diet. And, you know, one of the problems when people move to a plant-based diet is people are so used to filling up on what we call empty carbs, like fries and burgers and things. They go and then just eat lots of wheat and bread, thinking that's plant-based, and it's really not.
No, that would be super acidic. All processed, right, Fiona? All processed grains are just going to push that acidity needle, or push the needle into the acidic range, I guess.
Absolutely. So the grains that we recommend are millet, wild rice and quinoa. Even kamut I stay away from, because most people with kidney disease do better on a gluten-free diet. We know that in chronic kidney disease, especially if you've got things like IgA nephropathy, anything that you can do, because gluten in another way is quite immune provoking and inflammatory. So I quite like my gluten-free, and I'm a celiac myself, so I tend to go for the gluten-free ones, but they are your alkalizing grains. And then, you know, things like seasonings, which are herbs, as you would say in the States. In Australia we say herbs, are a really great way to add medicinal foods to cooking. In fact, traditionally herbs and spices are your traditional medicines that different tribes and cultures have used over the eons. So the more cooking you can do with spices and seasonings is a great way to get a greater range of phytonutrients into your diet. And Terry Walls, who I follow with MS, one of the things that we do with people with MS is we make sure we get 200 different varieties of fruits and vegetables into our diet in a 6-month period. And one of the great ways to do that, to get this bigger range of phytonutrients, is to cook with and season with herbs and spices. So you've got some great ones there that are alkalizing. And then you don't forget your oriental vegetables. I know, Matt, I think you quite like these, but I'm a huge fan of shiitake mushrooms.
All the mushrooms, reishi, shiitake, maitake, they're amazing. I don't want to get off track. This is amazing. So guys, this is free. If you just go below and click on the link, and it'll take you over to kidneycoach.com, right, Fiona? You can get this. All you do is give us your email. We don't spam. We just give you good stuff. We're all about good stuff to change your life. So this is free. And I know we're going to talk about neutral foods, but there's also recipes in here, right?
There's another download. So there's,
cool.
Get onto that website. There's another one there with 30 great recipes in there that are all alkalizing.
You can take this to the grocery store.
Yes.
And you could be your own doctor, right? Like, let food be your medicine. Let your medicine be your food. That was Hippocrates, not a hip hop artist, who was actually a doctor, a Greek doctor from over 2,000 years ago. And if I wasn't a hip hop artist, my name would be Hippocrates. But yeah, let medicine be your food, let food be your medicine. And it's all right here.
Yeah, that was something we were talking about before, about empowering you. So this is what Matt, take it to the supermarket with you. What a great idea. So sweet potato and pear and your berries. And then we go to what we call neutral foods, and they don't move your body towards alkalinity or acidity. So they're things like eggs, raw goat milk, organic milk. Although again, if you follow the kidney disease solution, you'll see that Dr. Matt and I both recommend that you don't use dairy. Sorry, Duncan and I recommend that you don't use dairy products. Again, they're very acid inflammatory forming, so we tend to try and stay away from them. But brown rice and buckwheat is in there, and then we come down to our acid forming foods.
Ooh.
Yeah, and you'll see like all the fats and oils. And again, people think that fats and oils, that there is some good work with fats and oils. They are useful, but you've got to remember that they're acid forming, so we use them very sparingly. I tend to
That's right. It's good to remember this is really in the context of trying to create more alkalinity. So these things do have some nutritional benefit for sure, but when we're really trying to move the needle into alkalinity, it's so important to remember what to remove for a while.
Yeah, and if you are following the Kidney Disease Solution Program, one of the parts of the program is you get a cookbook, and in the main cookbook you'll see that we've used the 75-25%. And so when we created recipes, 75% of the recipe will be alkalizing, and then 25% will be acid. But if you have that in combination, it's still an alkalizing forming diet. And we recommend that for people in stages 4 and 5 of kidney disease.
So I could eat a little rabbit.
You
right?
could eat
I have 25% of rabbit.
You can eat a little bit. We say that more if you're in stages 1 and 2, that you could have, we tend to say you can do a 60-40. So 60% of the recipe or the diet that you eat in a day should be alkalizing, and then 40% can be acid. And in the recipe book, it says how you can slightly change the recipes to move them from a 75-25 to a 60-40. But if you're in stages 4 or 5, you really need to be 75% of what you're eating. And if you're in stages 4 to 5, I would omit meat from your diet. Yeah. If you're going to have anything, maybe a little bit of chicken once a week, and then you get your proteins through things like
cute rabbit.
No rabbits.
Yeah.
No rabbits.
And just so people know, the kidney disease solution ebook goes into depth. And if you also get that, there's a 21-day program that I've created that kind of walks you through that. So, so why don't we go ahead and close this video out, Fiona, and just really direct people. Please subscribe to the video below, or subscribe to the link below, and you can get this for free.
Yeah, and that'll give you all of that information. And then you've got your list of foods. When you go to the supermarket, you know what to avoid. The other quick thing to note here is most of your drugs and medicines, acid forming. All right, guys. Well, hopefully this video has been useful for you. As Matt said, subscribe below or head over to kidneycoach.com. Go to the Start Here page or to the home page, and you'll see there we've got some downloads there that you can get for free. And one of them is the alkalizing diet, and there's also a recipe book there if that would help you. So until next time, see you then. Bye.